from a different perspective, we can also think of the entire Aarogyasri program as if a huge boost in the demand side of the entire healthcare market. The reason I'm saying that is probably one of the biggest predictor of demand you all know are prices. So essentially what it is doing, it's making prices zero for quite a big chunk of population and for selected procedures. So this is going to create a huge demand for services, particularly those which are listed or covered under Aarogyasri, and the assumption is that the supply side is ready for that, right? So we cannot really expect things to work if there are not enough hospitals. But I would ask Professor Narayana to highlight this issue, particularly for Bihar. We are trying to boost the demand side of the healthcare, but is the supply side of the healthcare ready to take on that challenge?
Let me take off from where Chandrakant left off. Namely, health outcomes are dependent on access to quality care. Now let us this is just a table. I went to the, Ayushman Bharat site, took the results for the state of Bihar, some of the districts. In fact, you have 23 specialties. I just taken 2 specialties just for illustration purpose. It could be any other specialty. What do you find here? You find district after district. It's basically the public institutions which are empaneled. There are hardly any private institutions, except in Patna and Muzaffarpur. So, if you are talking about choice, where is the choice? Of course, in the months to come and maybe in the years to come, probably choice will come about. But as of now, from the data that is put on the site, this is what you get. And what are these public institutions? Largely PHCs, and some districts you also have referral hospitals and CHCs. Now, what is the problem? If you have predominance of PHCs for somewhat relatively simpler sort of a procedures. Now, this is also well known. I have presented the IMR and neonatal mortality as a proportion of the IMR for Bihar for the, from 2007 to 2016. IMR, of course, came down from 58 to 38. But you just look at the neonatal mortality rate. What has happened to that? See, it was about 50, 53, 55 sort of a thing in 2007. It has shot up to over 70 now. You see, ideally, if you have lot more institutional delivery, neonatal mortality should not be going up like this. So obviously, there is some problem with the sort of institutions where they are going for delivery. Of course, this is only part of the thing. If you look at the MMR results, you will probably get more or less a similar sort of result. In fact, there is a slightly different dimension to this. Now, when I say IMR, you can have IMR for female infants or male infants. I'm sorry to say, if you look at the results, there is something very, very disturbing. I will read out the raw numbers for Bihar. Male IMR, it declined from 44 to 31 between 2011 to 16. But female, can you guess the number? 2011, it is 45. More or less the same as the male mortality thing. But it stays put at that level. That's why if you take the IMR for female divided by the IMR for male, what you find is that it has steadily gone up. In fact, it should not be behaving like that. As you know, mortality for infants, it should be higher for males. But here what you have is the reverse and a worsening situation. This is an issue on which I had worked a few years ago. There's a paper, and I'm coming back to that number, and it's shocking, because I thought things should improve, but it's not just Bihar. Elsewhere also you have similar sort of a, but let me leave that and come back to the public institutions. What's the problem? Look at the PHCs. This is what, it's a transition matrix that I have worked out. That's basically population covered per PHC. What is it that you find? You find almost all the states are lying in that diagonal sort of a thing. 10 years of NRHM, practically no improvement, except Jharkhand and Karnataka. Otherwise, most of the states are where they are over a 10-year period. And you know where Bihar is. In fact, if you look at the sub-centers, that's a transition matrix, I have not shown here. What you would find is in Bihar, as of now, you have one sub-center for 10,000 population, whereas the norm is about 5,000. In fact, the CHC also, it is no better. But of course, slightly better, because if you have a larger number of states which have moved leftward from the diagonal, that means the situation is improving. But where are they improving? They are improving in states like Kerala and Tamil Nadu, where the situation is already much better. But you look at the states, where improvement is needed, you don't see that. And Bihar also comes in there. And why is it that one is emphasizing this? In fact, the reason for emphasizing this is that normally one would associate with institutional delivery and whole lot of other sort of primary care that, antenatal care, postnatal care, this would also improve. But you don't see that sort of a thing happening. In fact, these are the sort of a numbers. This is from NFHS 4 for 2005-6, 2015-16. I don't think things would have improved in the last 2-3 years, but this is the sort of a picture that you get. So institutional delivery has gone up, but IMRs have gone up, not gone up, but has not come down in commensurate terms. MMRs, I have not given the numbers, but situation is not much better. So what it then points to is that expanding healthcare coverage does not necessarily result in better health outcomes. Now, in fact, already I think Jeff referred to that yesterday, JSY and what's happened and all that. In fact, there is a recent article in the Lancet, which I just partly quoted that. Many of the births in the program occurred in primary care centers that did not have sufficiently skilled staff to address maternal and newborn complications, and hence did not result in improved maternal or newborn survival. So what is Ayushman Bharat offering the people? In fact, going by the first slide, no choice, because there are no private providers. In fact, let me tell you from the experience of Kerala, the package rates, in fact, NHPS has come up with the 1, 3, 5, 4 medical packages, and they have given the rates, and the states don't have much flexibility to change those rates. There are some sort of we had a difficult time working that out in Kerala. So with such rates, in fact, we had a meeting with the private providers in Kerala. They said they are not going to participate in it. And then they made a huge press conference, and they said, with these rates, we cannot be part of it, because we will not be able to survive. So it's not that the situation in Bihar would be any different, because most of these private people, I don't think will come for these sort of rates. And there is no guarantee that the rates are going to be periodically increased or anything of that sort. That's also an experience of the RSBY, because there is no mechanism for regular rising of the rates or anything of that sort. So one doesn't see, many of these private providers coming. And then if you have poor quality, then the sort of health outcomes that is expected from this sort of a program, you are not going to get that. So my final point, no alternative to improving the quality of public health system. That's why a lot more money needs to be spent on health and wellness centers. That's Chandrakant's point. Thank you very much.